All right, back to the latest with regards to the COVID-19 virus. China's ambassador to South Africa has again given the assurance that South Africans in his country are being taken care of and are unlikely to contract the COVID-19 virus. Precautions are being taken to ensure that no Chinese national exports the virus to Africa. Meanwhile, some private hospitals in South Africa have contingency measures in place following the first confirmed case here.
Nothing.
Not leaving anything to chance. While some private hospitals are taking extra precautions, the lines may be slightly long, but you cannot enter or leave the hospital without being checked. A short questionnaire about your recent whereabouts, a strict sanitizing protocol for everyone, staff, patients and visitors, and also heightened awareness of protection measures.
The National Department of Health, both the public sector and the private sector, are very well organised in screening and in managing this, and I think that we are very well positioned to take care of this as it may develop further in South Africa. The hospitals, both public and private sector, have very well developed protocols about what should be done with patients who are suspected to be positive. So we have all the personal protective equipment that's required, and so doctors know to use that and to protect themselves. And it is a problem if doctors become exposed, because then they have to self-isolate, and that does reduce the number of doctors that are available to care for patients. But there are good policies in place, and that should assist.
South Africa says it's still on course to evacuate 184 of its citizens from the epicenter of the virus. The South African National Defence Force has dismissed reports that its members are refusing to be deployed to Wuhan because they fear being infected. Meanwhile, China says it continues to implement stringent measures to protect other countries.
We must take this most stringent, silent measure to stop the virus from coming to this continent. We are proud, up to today, you are the less country and less confirmed cases in the continent. Because we understand when this continent gets infected, China, we have to fight in two continents. And that is a big change to us. Now we are continuing to fight.
Cases in 7 African countries have been confirmed. Griselda Lewis, SABC News in Johannesburg.